Talking about transformational change can feel threatening, especially when many of us are a part of the very systems we're questioning. But moments of disruption, however uncomfortable, can also create permission to rethink structures we've long accepted as the norm. My name is Lisa Smith, and I'm the Global Program Leader of Market Access at PATH. I've been with PATH for nearly 10 years and in working in global health for nearly 2 decades. Much of my work sits at the intersection of business, economics, and public health. 2025 marked a period of profound change for the global health sector. Through WomenLift, I've had the unique opportunity to step back and reflect on my role within this moment, examining leadership, power, and how both can be leveraged to catalyze institutional change. Before diving into the insights of my leadership project, I wanted to briefly reflect on how the project itself evolved. When I applied to WomenLift in 2023, I was in a different role, reporting to a different manager and working within a very different global health context. My original project focused on expanding the existing mentorship program for young women in PATH's country offices, strengthening connections across a globally networked organization. By the time I joined WomenLift in 2025, the landscape had shifted dramatically. Changes in U.S. government funding directly affected nearly a third of PATH staff, many based in the countries where we work. The pace of change was relentless. After revising my scope twice, I ultimately broadened my focus to examine the future role of international NGOs in global health. As PATH began shaping its next 5-year strategy, and as I stepped into a new program leadership role, this felt like a timely opportunity to ask deeper questions about how INGOs can improve cost efficiency, advance gender equity, and strengthen locally led leadership. The INGO model many of us work within was built for a very different moment in global health, different funding flows, power dynamics, and expectations. Today, organizations are being asked to deliver greater impact with fewer resources, while also shifting power and leadership closer to the communities we seek to serve. So the question isn't whether INGOs need to change, but how. This project explores what transformational change could look like and what it would take to get there. To do that, I reviewed current literature on the evolution of INGOs and conducted key informant interviews, organizing insights by theme and stakeholder group. While interviews are still ongoing, some early themes are emerging. At their core, INGOs were built to manage complexity. Donors have different reporting, audit, and compliance requirements, and INGOs develop systems to absorb that burden and make funding workable at scale. They also offer economies of scale, allowing donors to operate across multiple countries, to staff up quickly, and to manage risk in fragile contexts. By aggregating projects, INGOs can stabilize staffing over time, which matters in highly competitive talent markets. But these same strengths create real weaknesses. Many INGOs have become defined by what they win rather than where they add the most value, driving mission creep and growth for growth's sake. And despite commitments to localization, power and decision-making often remain centralized. Even when leaders are placed in country, authority frequently snaps back to headquarters, slowing responsiveness and limiting inclusion. So what needs to change? On the INGO side, there's a strong call to refocus on comparative advantage, being clear about where INGOs truly add value and where others are better positioned to lead. In some cases, the most strategic and inclusive move is to step back. Decentralization also has to be real. Matrix structures only work when decision rights are clearly defined and authority genuinely sits closer to the work. People matter deeply. Investing in local and female leadership through succession planning, career pathways, and better benefits is essential for long-term impact and retention. To support this, INGOs also need greater financial resilience, including flexible funding and reserves that allow them to be proactive rather than reactive. At the same time, broader systems barriers can't be ignored. Compliance requirements have become so complex that many local or regional organizations simply cannot participate without support. We also need to rethink what we mean by local. Presence alone doesn't guarantee equity or inclusion when power dynamics remain unchanged. Finally, donors play a critical role. Metrics need to shift from what's easy to measure to what truly matters. Funding models need to be longer term and more flexible. And the sector must prepare for a future with less donor assistance overall by engaging the private sector more intentionally. Finally, I'll close with a few personal reflections from this leadership journey. First, understanding my leadership principles was essential. They guide my focus and serve as a constant checkpoint as I navigate the INGO system I both benefit from and want to see changed. Second, this work isn't time-bound. I need to stay in a posture of reflection, examining my position, engaging with others' perspectives, and discerning when and where I am truly needed. Third, influence must be exercised strategically. Knowing when political economies allow for change and when to apply political capital selectively is critical in moments of transformation. And finally, I have a renewed commitment to use my leadership role to be a force for good, centering those most impacted by poor access to healthcare, especially as resources become increasingly scarce. Thank you.